Way hey ya ho eh ho, 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 way hey ya ho eh ho.
When thousands of Indian people moved from the reservation to urban areas, the federal government offered enticements, promises of jobs, vocational training, even the financial aid and assistance. But when they were brought out here, they were pretty much abandoned. San Francisco recognized that there are Indian people living in the Mission District and that they weren't accessing health care. A group of leaders in the Native community gathered together and began advocating for medical services for our community.
Even though we were having a lot of financial problems, we didn't have that much funding. We made our commitment to stay because the clinic is needed in this Bay Area.
So the buffalo faced his adversities, walked towards the storm, and said, "We'll get through it." The 70s was a decade of awareness. The 80s was a decade of survival. 90s was a decade of dreams. 2000 was the dreams began to come true. And when we saw that, we started to dream bigger.
COVID was an incredibly hard time for the health center, but we were leaders in giving out vaccinations.
This community suffered tremendous trauma pre-pandemic from racism, from poverty, from underfunded schools. Our engagement with the Native community allowed us to get the word out, dispel a lot of the myths and untruths about the vaccines, and get people over some of their hesitation. So we're very proud that 97% of Native Americans in Alameda County received the vaccine.
The journey that we're on is a journey of compassion, a journey that requires determination and perseverance.
When I first arrived with my son, he was a newborn and didn't know exactly how we were gonna make it. And every step of the way, I felt literally a hand come from this place. It created a structure and a padding and a meaning and a purpose for us.
I'm not ashamed to talk of where I've been through. I've been in prison for 21 years. And I'm not proud of it. I'm not ashamed of it. It's got me from where I am today. It's been a blessing to be here at the Native Center. The favorite part is not being turned down,
I get what you call personal service, and for us being seniors don't get the care that they should get. But here, they're just not here to make me comfortable. They're here to make me extend my life.
We are working on a development project at 3050 International Boulevard. One of our primary focuses will be the expansion of our dental clinic. This project will have over 75 units of affordable housing. For that project, we're working with Satellite Affordable Housing, who's been great partners. In addition, our space will include a cultural community center.
It's not a place yet, it's an idea. Longevity is somewhere we're going. Longevity is acquiring land so that not only that we ensure that our culture survives, but that our culture thrives. When we talk about that holistic system of care, this really is that gap, and that's the land to connect the people with, and to really have a place for all those celebrations that we want to have.
Our community is getting stronger, our community is getting healthier, and our community is staying connected to our cultural, traditional, and ceremonial ways. I'm proud to be an American Indian. I'm proud to be a Lakota, and I'm also proud to be a Native American Health Center employee.